Dr. Margolis, I really want to say thank you for taking valuable time. We're here past hours. The sun's already gone down, and the fact you would take time to not only help educate me, but educate patients out there. And in what I've gotten to know about you, I'm really grateful that you'd hop on and join us for this. So thank you.
Well, I want to thank you. 2 nights ago, you gave me a phone call, and it was from out of state, and I had done some surgery on some out-of-state patients, and I don't know all their numbers, so I have to answer. This is Matt, and that's all I heard because you kept on cutting out.
Oh, man.
And you told me about what you were doing, and I said, I got to meet this guy. And that's how it's began.
Yeah, and I appreciate you just stepping out and doing that. And we've talked about why the heart behind this of doing the full mouth restoration on implants, and initially you told me that you don't do the 4-on-4, and I understand that. And that's what's crazy is most patients out there think that the full arch restoration is synonymous with the all-on-4 or the 4-on-4. Whereas clinicians think about it a lot more along the lines of how many implants and what is the actual procedure you're doing to place them, correct?
I would say that's your average person.
Yeah.
And the person that's going to be pushing the 4-on-4 is going to be an oral surgeon and a prosthodontist that usually work together. And you have many different businesses under different names that do that. It is a fine restoration for some people,
Yeah.
especially if you lack the bone to be able to put many different implants in.
Right.
But they're titanium based.
Yeah.
I'm a biological holistic dentist. I do not believe putting metals in somebody's mouth is healthy for that individual.
Well, that's going to tee us up, and that is the reason why I researched you. The way I came to know you is I know Dr. Dino Prado well. I've got the utmost respect for that guy. He is doing things that others just say can't be done.
They don't even dream about it.
They can't even comprehend
Dr. Prado
it.
is amazing. He's always been ahead of the curve,
Yeah.
and he has always stepped out and taken the challenge and has put his actions where his money is, or money where his actions are.
Yeah.
And his goal is to make a better life for individuals.
Yeah.
And you know the patients he gets.
I mean,
They've
been almost forgotten about by Western medicine. They go get your affairs in order. We've done everything we can. Good luck. Go home to die. That's who he gets a lot of.
I know. I've seen many of his patients. He's referred me now.
When I was talking to Dr. Prado about, you brought up the fact of the biological dentistry, and with my experience, not only with dentists, but I've also had a lot of experience with integrative doctors, and I've learned, what made me so powerful on the dental side, my love for dentists, and my background, and my background with that has also helped me on the integrative side, because there's a lot in integrative medicine that has you go, what, really? And as a layman, if you will, or a not stupid but uneducated patient, that where I was going, where I first started hearing about how your mouth is connected to your entire body and how it affects your entire body, it really took me a hot minute to really even comprehend that. I do believe that now, but do me a favor. Help me understand that as though I am, for the first time, coming and hearing what a biological dentist is and why that is so important and how the mouth works together. It's a lot, I know.
Whoa.
Yeah.
A biological dentist believes that the mouth is connected to the rest of the body. In medicine today, we have specialists in hands, we have specialists in feet,
Right.
we have specialists in eyes, ENTs, we have specialists for every specialist, there's a specialist. And they seem to lose the forest within the trees.
Yeah.
And unless you can connect and take a look at what one part of the body interacts with the other part of the body, you say, oh my gosh, how can this be? So when you started saying, well, the mouth is integrated to the rest, I have the pleasure and honor of having one of my sons who is an oral surgeon today. And when he went to dental school in another state, I always flew up to see him every year. And he would tell his classmates that, gee, Dr. Margolis, my dad, will look at a panoramic x-ray, which is the one that goes all the way around your mouth. And he will tell you your health history. And so one film was held up to me, and I said, you got a diabetic here. And the student says, he's not diabetic. I said, oh, yes, he is. Take a look at how the gums and the bone have receded evenly throughout his mouth. And he looked at me, he says, I'll prove it to you that he's not diabetic. I said, okay. How do you know that? He says, well, that's how he answered the questionnaire, not diabetic. I said, do you believe everything that you read? The patient was sitting in a chair across the way. And he goes up to the patient and says, Mr. So-and-so, I got a question to ask for you. Are you diabetic? And the man turned white. How did you know? He says, I just got back the results from my specialist, and he told me I'm diabetic, and I never knew it. Now it explains why I got the problems in my mouth, why I'm getting all these cavities. The reason he got the cavities was he had all mercury in there. He's diabetic, uncontrolled blood sugar. The metals are playing havoc with his blood. So there are connections, direct connections.